Welcome to today's episode. We have exciting guests, Anton Hocking and Erik Laine from EcoCare Network to empower people with compassionate behavioral health services, fostering resilience and well-being on their path to recovery. So for those of you who are just joining the podcast, we are IQ Consulting and we specialize in helping any business scale their revenue over 12 months. So if you want to learn how to take your business to the next level, just make sure to stick around. So Anton and Erik, today we're going to explore your business model, where you are today and where you want to go and what's blocking you. Sound good?
Yeah, it sounds great.
So the first question I want to ask you is how did your company start and what was the initial problem you set out to solve?
Yeah. So about 20 months ago, we actually bought into a franchise. Unfortunately, the franchise that we bought into, it was a behavioral health care company that provided life skills and mentorship to children. And so when we first got into it, we got into it kind of by accident, just through a friend of ours. And when we started to kind of build out the business, we were pitched the business as more of like a passive opportunity, and so we really didn't have any knowledge in the space at all. But what kind of happened is since the failures of the franchise that we bought into, we started to build out our own systems and our own network and started to really collaborate and actually get introduced to a lot of people in the behavioral health side, everything from billing and credentialing teams to LPs, LPCs, a lot of coalitions and supervisors. So we were unfortunate and fortunate. The franchise that we bought into did not work out, but that actually led us to start Echo Care Network and also
Mhm.
Echo Healthcare Partners. We have two different verticals. One is going to be simply the behavioral health side, where we are helping the kids. We're going into the homes. We're helping these families gain resources and just give them somebody to lean on. And then we also have the side where we've built out the management side of it, where we can help them with every aspect of their business, everything from billing and credentialing down to outreach and things like that.
That's pretty impressive, actually. What's been the biggest growth driver for you this past year?
Well, I think the mission really is the most important thing. I've been a lifelong, bartender. I've always been in the service industry, so I've always enjoyed serving people in general. But really, the driver is the kids. Eric and I both have three kids. We both know that mental health is a huge issue in today's society. There's a lot of
Oh,
different things driving that. There's social media, there's the news, there's the media, there's a number of different things that are happening right now that weren't happening when Eric and I were younger. And to see that I've struggled with mental health. Most people I know have struggled with mental health, but there's really, up until a few years ago, no one really took it seriously. And I think now it's more of a mainstream thing where people realize that it is a really big issue and that your best friends, your neighbor, a lot of people are struggling with it in different capacities. And so really it starts out with the kids. We want to start out by helping the kids first and making sure that we kind of cut that off at the very beginning of their life instead of waiting until they're older. So we've really been focused on that. And waking up in the morning, the driving force is waking up knowing that we're going to help people. And I think that's a huge reason why I'm so passionate about what we do and so excited to wake up in the morning and do something that is purposeful.
that's very impressive, actually. Can you just tell me about your background more, Erik?
I went to college, came out of college, worked for a company, was doing like office work for, quite a few years, and then got into real estate. And so I was a realtor from probably '07, like during like the crash really of like '08 when that all happened. I was working with different investors and got my contractor license, did all this stuff. So I started becoming a business owner at that time. And then real estate all the way up until I moved down to Atlanta right before COVID hit. And then during that time, like real estate was kind of done for a while. And I was kind of became like a stay-at-home dad really. And Anton had a friend that, had an Amazon store going. And I'm like, I'm interested to try that. So we started doing that about 4 or 5 years ago. My store, we also do, so we do some e-com stuff on the side too. And my store has done really well over the last, few years. And anyway, that kind of led us into like, we created a YouTube channel and started talking to people about passive income. And that's what led us really through those connections, got us to where we're at today, where we met the Texas Care. That was the franchise that we can cut that out, maybe the name, but like the franchise that we purchased into that didn't work out and
Yeah.
turned and now, which again that became a blessing because it really forced us to learn how to do this all on our own and go and build the systems out from scratch. And now we have the model, so we've got the ability to run these behavioral health clinics we've also built a management side around this too, where we can help any other clinicians or people that have any or that are trying to run their clinics. We can help them get credentialed and help. We can help hire their admins, help like really do this. Where we're putting together a model where they could have their employees employed under our management umbrella, so they can get healthcare, we can get HR, all that covered under that. So we've really built something pretty awesome over the last. It's been a while, but been 20 months of putting into this. But we have clients that we're seeing right now. We're finally getting towards revenue, and we've put it all together. Again, like what was unfortunate in the beginning turned into now a blessing that's allowed us to grow something and be able to take this other places. We're in Texas right now, but move this into other states because it's needed everywhere, not just in Texas.
Absolutely. And especially after COVID, right? So
Yeah,
it's been a nightmare for those kids.
right.
So really appreciate your service. And it's very interesting that neither of you have healthcare backgrounds, but you're actually very passionate about what you're doing. And your passion is really your driver right now.
Me and my family, my mom's she's got her master's in social work. My sister's a psychologist, so it's kind of in my family, but I've never been a part of it. I've been more on the business side, but the model we've put together, when you bring the business side to it, I mean, it allows us to expand out and grow this bigger than it could have been.
Mm-hmm.
And the driving that the factor that or the starting point that we started with is with Medicaid and bringing this to like a lot of times our QMHPs are qualified mental health professionals. They actually go into the homes. So they're actually meeting with these kids in their homes. They can see what's going on. They can see if there's like food shortages. They can call crisis. There's different things that can happen and we're serving an underserved population that maybe doesn't have the ability to travel or take their kids somewhere. We're coming to them. And so we're
Mm-hmm.
meeting in the homes and in the community. So it's pretty awesome program that
Mm-hmm.
allows for like again an underserved population that normally doesn't have access to these types of services. We're giving them the access to it, which is pretty cool.
Yeah, I'd like to add something too. It's like because the whole healthcare system is broke right now. I mean, there's a lot that can be changed. Eric and I are deep thinkers, and we like to think outside the box on a lot of things. And I think having that business background, I mean, for the 30 years I bartended, I've been an entrepreneur also and run different businesses on the side. And just, that's why bartending was such a blessing to me because I could make my own hours and work when I want. So I was able to
Mm-hmm.
do other things, but the opportunity to meet people and to network, it's really helped us build out these two companies that we're building out. And it's enabled to think differently than somebody that just comes from that background and that comes and has a look from the outside and how you can actually scale this and how you can help more people,
Mm-hmm.
and just bringing the right connections together, taking the main four partners that we have and then bringing them together to create one large ecosystem is really what we're putting together. So we have that ecosystem to be able to funnel down to the clinics and expand the
Yeah.
clinics faster and in a more efficient way.
And that's definitely when you talk to somebody that's in this field that is in behavioral health, like psychologists and all the, and social workers and all that, they don't have that business mindset. They're more about helping the people, but they don't know how to put this side of it together to scale it to make it bigger a lot of times. So mixing those two worlds, I think, really makes something happen here that could make this big.
Absolutely. And how many people do you have now? How many employees?
Not a lot of I think we have, like, only 6 main employees, but it's not necessarily about how many employees we have. It's the partnerships that we've built out, right? So we're partnered with very, very large companies. We have an HR company that we are partners and friends with the daughter of the owner, and I think they've got millions of employees that are below their umbrella of companies. The name of that company is Vensure. Vensure. And then I have another company we have an EHR company that's well established. And, the EHR company handles most everything that it came from a different background too. So they have things that they've put into their system that most other EHR systems don't have. So they have 4 or 5, 6 different services that they offer, and they're easy to work with, right? The partnerships that we bring in, they want to partner, they want to scale with us, we want to share ideas with them, they want to share ideas with us. There's, I mean, a multiple of different companies that we have are in the works with talking about partnerships. But now bringing those companies together to network and to learn and to bring their services together in a way that we can grow together as a group and utilize each other's skills and knowledge.
You've only been at it for 20 months. So if you could press a button and remove one operational bottleneck, what would that be?
That would definitely be credentialing and accreditation. One of the main things that happens when you start a behavioral healthcare clinic, the first thing you need to do is get credentialed with Medicaid,
Mm-hmm.
MCOs. Right now, we had a meeting before this actually with our credentialing lady. We were credentialing and seeing people, but now we have to get new credentialing. So there's 40 different MCOs, they're insurance clearinghouses that we need to get below Medicaid. And so the ability to get those is probably the most difficult. And then making sure you're staying on top of compliance. And each one of those MCOs has different rules and they have changes. So staying on top of that. So we come from an AI background as well. So we've been able to build out
Mhm.
softwares and systems to be able to track that stuff and make sure that we're keeping on top of it using AI and our systems
Mhm.
to do that, right? So every day something happens, it changes, and we have an idea or we have this or that. But credentialing and accreditation is definitely the biggest roadblock or hurdle, and it's something that unfortunately is the way it has to be. But but there's things here and there, but that's pretty much the main one I'd say for sure.
So you mentioned that you're using AI. Where have you implemented AI? What
Yeah.
specific areas?
Yeah, so Erik, I'll let Erik talk about that a little bit. He's the one that's been I'm kind of the idea guy, and
Uh-huh.
then he'll build out the software, and then I can use AI and I can build websites with it and apps, but Erik is really the brains behind organizing the AI in a way that you like
Yeah.
it's wild watching him. I'm going to tell you, it's crazy what he does, but
Mhm.
Yeah, I built out quite a bit of stuff, but like a lot of it, like he's keeping track of a couple of the biggest things I built first was just like having all of our calls, all of our recordings go into a folder, and then every day we get an email of the breakdown of what happened yesterday and all the to-do items and all that. And then I have a weekly one that goes out. And then that also creates like a weekly newsletter that we send out to our different people that we work with that go out. So tracking a lot of stuff like that, just keeping like a brain of everything we've been doing. But then I've just
Mhm.
started building out like my own softwares because I've never liked like QuickBooks. So I built my own accounting software that we've been using. So it's simplified, built our own CRM system and connected it with Twilio and have email so we can email and get text through it. And then I built out like a social posting tool where we can post to like a bunch of different blogs onto our website and post out to like 9 different social platforms. And then again, that takes in all the stuff that we're doing and makes the ideas for us. So every day when I get that breakdown, here's at the bottom are like social post ideas, and then I put them into our posters. Just a lot of like automations and stuff like that. And I'm learning every day. Just watch YouTube videos all day long at the gym, watching YouTube videos while I'm working out and just learning.
yeah, the task manager is the latest one we've built out is, what was the company that has the main task? It's like Trello, or like a Trello board.
Yeah, Monday
Yep.
or those types of
Yeah,
things. Yeah.
Monday. Yep. So we built our own task manager. And it's
Yeah.
cool because when you start building it out, you can add what you want to do. You can add what
Hey,
you want.
make it just tailor it to whatever you need.
Yeah. Yeah. And it doesn't, I mean, for Erik, it's easy. For anybody else watching it, it's not easy. I mean, it's not easy for me and I'm pretty in depth with it, but you
Mhm.
can kind of, it's a custom software. And that's one of our
Mhm.
other companies is marketing and AI consulting. That's been a blessing to build this company because it just made us that much faster to do things really.
Yeah.
Yeah.
Eric, you sound like a mad genius.
Yeah, yeah, I don't know. We'll see.
So then, guys, looking ahead, what is the biggest opportunity that your team needs to focus on?
I guess I think the opportunity that we need to focus on is connecting with as many clinicians and behavioral
Yes.
health professionals and just showing them the possibilities and showing them that there's an easier way of doing things and
Yep.
that there is support. We can support them. We don't really even have pricing. I mean, we work with
Mhm.
each individual clinician to kind of see what their needs are and we come up with a plan for them and everybody's different, right? Everybody has their own budget. We have some huge organizations that really need a lot of help and you have some that don't. You have some smaller organizations that need a lot of help, but you also have the everything in between, right? So everybody's circumstance is different. And I think when we have our consultation with people, we've already been consulting a number of different psychologists that we're partnered with that we're helping already. But I think the greatest part is connecting with them, getting to know them, and then starting that conversation on how they can come into our network and help the overall bigger picture of what's really going on in the world and having that opportunity to bring value to them. And they also bring value to us as well because they're sharing their ideas, they're sharing their struggles, their hurdles, things like that. So taking everybody's input and bringing it into one main brain AI system and then just making the ultimate system to make this a worldwide or nationwide thing.
Yeah, a lot of them too, back to them not having that business mindset, a lot of them too, they're they're meeting with clients all day long and you're
Mhm.
talking and taking in all this energy from these people, and by the end of the day, you have no energy left, most likely. And if you're a one-man shop, Now you're trying to
Yep.
figure out how to do all this, get credentialed and how to do all these things and staying on top of that whole compliance side. Like it's very tough. And then having to hire an admin and trying to like do all like, so we could take a lot of that off of somebody's plate and make their life easier. So, um, that's kind of part of what we built around the management side of it, which can help clinicians. That's one of the big things. And then us just getting the word out on what we're doing with the kids and everything too. And growing that side of it because there's millions just in Texas alone, millions of kids that, just on Medicaid, but we're adding in cash pay and insurance and everything too to be able to help everybody and offering services like a lot of these schools, they have waiting periods. Like some people, they come into these programs and they're being told like 6 to 12 months just to get assessed into something. Our goal is to meet with somebody, have them assessed and seeing somebody within like 7 to 14 days, hopefully. So that's the goal.
Yes. I have several clients or friends who are actually in this space, and it is a challenge. So, in this complex environment, how are you thinking about scaling or adapting your strategies?
Yeah, I mean, as far as scaling goes, I feel like we have all of the
Mhm.
pieces in place to scale. We have much larger companies than ours, right? But even the companies that we're talking to, we're like very small, right? But it's
Mhm.
about the relationships and they know us and they want to work with us and they see our vision. So when we can put our vision and make them realize that it's a good vision and they want to be a part of
Mhm.
it. I mean, I would never thought in a million years as a bartender from Minnesota that I may be talking to this huge, massive company that has thousands of employees and they're excited to work with us. Like that's never ever been even crossed my mind until
Mhm.
Eric and we just manifest on a daily basis, making sure that we put out good energy and
Mhm.
stay positive about things. Really don't try to let the negative into our lives and just live every day happy and try to teach our kids the same thing.
That's
So really
awesome.
like the scaling part is like the partnerships that we've brought together. So we have the HR, we have all this stuff. It's not us doing it personally. We partnered with companies that bring it in. So like we hand it off to the experts. So we're kind of the middle spoke that brings it all together and oversees everything a little bit. So, but then handing it to the right people. Like we're big on just partnering and being with the right people that are experts in those fields and have them stay in their lane and do their thing. And we just kind of make sure that everything is staying together from a bird's eye view.
I kinda look at it as like you're a general contractor of a huge construction project, right? So we're the general contractors of the ecosystem.
So, last question. What advice would you give to other leaders navigating the same challenges?
I guess just network. I think that look for solutions, just really relationships. It's all build those relationships, start to learn about different industries, start to learn about AI. Call us. Like our network is vast. You can call us no matter what it is. Whatever what I feel like I can connect you with the right person no matter what you're doing.
Anton's the master networker. He picks up the phone. He's got a magical touch that just calls the right person every time, and it like connects to the like whoever you're talking to. I got somebody over here that'll be able to help you. So
It's your
your network,
bartending years that just speak, right?
your
Yeah.
network is your net worth. So that's
Yeah.
I think very important.
I literally just got done writing an about us for our website. But I was just thinking, I'm like, I need to just write it about us because we've never done that. And I want people to know who we are and what we do and how we can help. And I enjoy being on the phone. I enjoy meeting people. And I think that is the biggest part of it is like as a bartender, I'd meet thousands and thousands of people a
Yep.
year. And
Mhm.
the stuff that I learned that I never even heard of or that interested me, and then having two different people that I learned two different things from and realizing that, oh, wow, remember that person over here? I can connect them with this person over here and all of a sudden just watch it blossom. But then really never expect anything out of it. You don't ever expect to like, oh, I need a commission or I need override or
Mhm.
something like that. Just be humble and just connect people because you just love to do it and you love those relationships.
Yeah, and it shows, right?
Yeah, absolutely.
So, hey, great episode, guys. Actually, there's something that you mentioned during the our discussion that's caught my curiosity. How are you finding your leads?
Yeah. Eric can probably talk about that. We have a lot of different ways. I mean, we've never really actually had to go like find leads.
You haven't. Okay, so you're satisfied with the number of clients that you have right now?
No, we've done a lot with our YouTube channel to connect with like investors and different people over the years, but with the behavioral health now, I mean that adds a whole nother layer of like trying to find actual like families and parents
Mm,
and all of that, along with finding other clinicians. So I've been digging into cold emailing and like LinkedIn outreach and doing that kind of stuff, and then I built my own little CRM that we use too, but
mhm.
definitely always need.
Yeah.
leads
I mean, there's
need more.
always new ways
So,
of getting leads,
yep,
right? There's many
yeah.
different ways you can get leads.
Well, that's exactly what we specialize in for our clients. I can actually get into it a little bit more, but
Sure.
honestly, I'll need a little bit more time. If you're not opposed to a 20, 30-minute chat, then we can dive a little bit more into this and
Sure.
we could potentially, I could help you solve that problem.
Okay,
Yeah.
Any
That'd
thoughts?
be that'd be awesome. Yeah, because I think leads
sounds
both
good.
on the clinical side, or the, behavioral health specialists, and then on the family side too.
Yeah,
Yeah, no, absolutely. I would love to help you guys out. So
cool.
let me know for next week if you have any time, or the end of this week if you have any time at all, and then we'll chat.
Yeah, yeah. Are you on WhatsApp by chance?
I am.
WhatsApp, I get so many emails, and so it's hard for me to keep track of stuff. But if we can see a little
Okay.
WhatsApp chat so that I can see a notification when you'd say something and vice versa, and
Yeah.
then we just keep an open line of communication there, that'd be great.
Yeah, absolutely. All right. I'll be in touch. Thank you,
Awesome.
guys.